Thank you, Chair, members of the committee. My name is Lilly Melander, State Policy and Advocacy Director for Medical Alley Association. We are the cross-sector healthcare association in Minnesota that supports and advances Medical Alley's global leadership in health innovation and care. I appreciate the opportunity to testify in support of Representative Morrison's legislation, extending medical assistance coverage for women for a year after giving birth. I'd also like to thank the other testifiers and those who have submitted letters for sharing the data and background on why this bill is so important. This legislation will ensure low-income women have continuous access to health care throughout the critical postpartum timeframe, which is essential to improving outcomes throughout the state. Over the past year, we've seen the pandemic profoundly change many aspects of life for the foreseeable future, but it's also shown a light on issues that have existed far before the pandemic hit, but were worsened by it, such as health inequities for underserved communities and people of color and indigenous communities. Medical Alley has always been at the forefront of healthcare transformation, and we support policies that leverage innovation in technology and care delivery that result in increased access, improved outcomes, and at lower costs for patients. Healthcare transformation requires a new focus and urgency aimed at eliminating health disparities. This legislation is one step in that direction through improving access to maternal and infant health. Given the significant and disproportionate health and economic impact for people of color, indigenous, and underserved communities, every woman, regardless of their background or location, should have access to equal maternal health and care services. The Medical Alley Association strongly supports Representative Morrison's language to extend postpartum coverage for MA patients, and we look forward to working with her and other legislators to identify additional opportunities to leverage the insight and expertise of our members and bring their innovation forward to improve access to prenatal and postpartum care and address maternal and health inequities for people of color, indigenous, and underserved communities throughout Minnesota, both at a state and federal level. Thank you for your time today.